Hi, everyone. My name is Katrina Brooks. I'm the Community Relations Director for the Center for Adolescent Health at Johns Hopkins Bloomberg School of Public Health. I want to thank you for joining us today. We are about to have an exciting conversation around harnessing the transformative power of arts, music, and science for public health. We have panelists who will be joining us today, and those panelists include two of our wonderful young people from the Youth Advisory Board, the Center for Adolescent Health, and HeartSmiles, MD. So we have our panelists. I will introduce them to you. Let's start with Lori Rose Benson.
Hi, everyone.
Hi, Lori. So Lori is the inaugural executive director of HipHop Public Health. She has been a wonderful partner, and she's here today to discuss with us her work and to share with us the latest project that they've been working on and with young people around HipHop Public Health and the vaccines and COVID-19. Lori has served as Vice President of Healthy Lifestyles at the YMCA of Greater New York and the Executive Director of the Office of School Wellness Programs at New York City's Department of Education. She was raised in Brooklyn, New York, and attended New York City's public schools. Lori holds a Bachelor's of Arts degree from the University of Massachusetts at Amherst in Communications and Graphic Design, and a Master's of Art in Physical Education from Adelphi University in Garden City, New York, where she's currently an adjunct faculty member in the Department of Exercise Science, Health Studies, and Physical Education and Sport. Welcome, Lori.
Thank you so much.
We have with us Charles. We have Charles Lake, who is a 16-year-old sophomore at Mergenthaler Vocational Technical High School, and currently serves as a HeartSmiles youth leader and a member of the Youth Advisory Board. Charles is also a participant and a member of the Bloomberg and Goldman Sachs Partnership for Youth Employment. Young Elder is a 19-year-old recording artist, born and raised in Baltimore, and a graduate of Forest Park High School. She currently serves as a Healing Youth Alliance ambassador, a member of the Mayor's Trauma Informed Care Task Force, and a HeartSmiles youth leader. Young Elder is co-founder of a business entitled Quarantine Delights and a passionate advocate for better mental health for young people across Baltimore City. Joni Holifield is with us today. Joni is a Baltimore native and founder and CEO of HeartSmiles. Joni is passionate about the fight to rebuild Baltimore and believes that it starts with building up our youth. Through HeartSmiles, she is committed to serving the youth of Baltimore City. So we're going to start with a presentation that Lori's going to share with us to spur our conversation. This presentation is on the work of HipHop Public Health, and it's about 15 to 20 minutes.
Wonderful. Well, thank you so much, Trina, and it's really a pleasure to be here with all of you today. And I think it would be helpful to share a little bit about who we are, what is HipHop Public Health, and then we'll get into how we are, collaborating with the HeartSmiles and the Heartbeats on this really important work ahead. So, we are a nonprofit. We are a 501c3 that's based in New York City, but we work with organizations and schools and school districts and families and young people all around the country and around the world. And we do three main things. We create culturally tailored, evidence-based health literacy resources, really harnessing the power of music. So we create music and music videos and comic books, all ranging in multimedia to teach health concepts and also ultimately foster behavior change. We work really closely to engage other partners and like-minded organizations so that we can actually amplify this work. Everything that we do and all the resources that we create are made available for free, and we work really hard to really get to the point where we can spread and scale the reach of folks around the country. So, how do we do this? We have a model that we call the multi-education model. And so the multi-sensory, multi-level health education model, as most of you are familiar, you could see it's the social ecological validity model. But what we do is we layer onto it science, art, and culture. And I'll get into a little bit of what I mean by that in just a moment. Let's move on here. So let's just set the tone. And I saw in the chat before, someone said, how come there isn't music playing? So we got you. So when we think about music, right, it cements memories, it augments learning. It has such a positive connection to experiences. So why don't we harness it for other things? Like, why don't we harness it to connect to the things that we want people to remember and learn and stick with them? And so, music can also like energize and lift up spirits. And you don't have to be hanging around with Rocky Balboa, and I might be dating myself right now. So when you hear the song, it pumps people up, it lifts people up, right? So there's these very positive associations, and we work really carefully to kind of harness that and harness the neurological effects of learning through music and multisensory experiences to really foster health behaviors. And so why hip hop, right? So hip hop, of course, our roots are in Harlem, New York City. And that's where we started. And we started because we saw the devastating health inequities. And we wanted to be able to connect a community in a very cultural way. But also, if you look at the latest report from Nielsen, 25% of all purchased and downloaded music is hip hop. So while we care deeply and our target is communities of color, it really is the #1 genre that everyone is consuming and downloading. So who do we work with? The top row of folks that you see are really our main artists. They have been working with us, some for more than a decade. This work was founded by Dr. Olajide Williams, and unfortunately he can't be with us today because he's on an NIH meeting, so sorry, he sends his greetings. But he worked with Dougie Fresh, who is, if for those of you that are not hip hop adjacent, he is one of the pillars of hip hop, and he created the beatboxing. And he is just an incredible person, embraces, wellness and social justice. And all of this work actually started around stroke prevention because Dr. Williams is a neurologist. And he was wondering, how can we teach young people and families about the signs and symptoms of a stroke to sort of mitigate the impact of people coming into hospitals way too late? So it started around stroke education, and then it expanded around youth obesity prevention. And now it's really about using our model to tackle all types of interventions and health behaviors. We have a team that's really transdisciplinary. We are a small nonprofit, but we are backed by the research team at Columbia University Medical Center. We work with healthcare professionals, nutritionists, educators. My background, as Trina mentioned, I come from more of the public health education world. I was with the New York City Department of Education for 20 years just about, and started what has become the Office of School Wellness Programs, working with 1.1 million children in 1,800 schools. And so that's where sort of I complement the clinical side that Dr. Williams brings to the table. The creatives that we work with, and the Heartbeats have met some of them, are incredible multi-platinum producers, artists, animators. And we really work closely with people within the communities that we serve, so that there is not just a litmus test of, sort of like the coolness and the wow factor of it, but like, does this really speak to the communities that we want to reach so deeply? So of course we have a student advisory board. This one is based in New York City and rotates annually. And now, since we've moved into this world of the pandemic land, one of the sort of benefits of this crisis is really being able to connect to so many folks across the country, and just planting some seeds. But I really think we need an older group of advisory board members, and maybe we're looking at a few of them right here from the Heartbeats that might be able to join us on a more permanent basis. But we've always worked with 4th and 5th graders. A lot of our resources have been based in the K through 12 space, but really for youth and families. And again, having that youth perspective to say, this is just not what we want to hear. And we know as an older person that cool might not be cool. So having the right language, having the right feel from folks that are literally on the ground is so important. So just going back to the model a little bit, and I won't get into this too much, but I just want to give you just a sense for folks that are really into the research behind this. You know, the model contains 3 areas, as I mentioned: art, culture, and science. And so when we talk about art, we talk about the music primarily, but we also talk about dance. We have an incredible series of hip hop dance music and movement videos for physical activity and physical education, using elements of gamification, you know, storytelling, embracing all the types of elements that really can grasp people's attention, because right now attention is the #1 thing that we're all trying to get. And I'm sure even right now, many of you have been in, this might be your 3rd or 4th Zoom of the day. And so hopefully, you know, we can keep your attention, showing lots of multimedia and music and some videos coming up. But basically, you know, culturally tailoring the videos, the nuances, the norming, and basing this on research. The science part of it is not just about using evidence-based strategies around the messages for behavior change, but also it's about the stickiness, the contagiousness, the sort of the neurological elements of learning through music. And what we know, and what I've learned a lot working with all of our neurologists who have founded this, is that music occupies more neural real estate than even language itself. And that's why I know how a bill becomes a law and a bill goes on Capitol Hill from Schoolhouse Rock, dating myself again, because that is sticky. And those sort of tricks that advertisers and marketers can do so well to sometimes get us do the things that may not be the best for us, you know, we harness that and use those same sort of neurological techniques with health behaviors. Another big piece of our model is really having youth at the center. And if you want to dig into any of our research on our website, there's a whole list of our publications and peer-reviewed journals and abstracts. It's really about harnessing child-mediated health communication. So, for example, with stroke, you know, a lot of people say, well, why are we teaching young people about stroke? They're really, really low risk. But young people can have the agency to call 911 if they know the signs and symptoms. Young people can teach their family members if they're so busy working and they're not able to sort of learn about these concepts. And so this is key. And this is the research that we've done about child-mediated health communication revolves around stroke, but also revolves a lot around our nutrition menu board literacy concepts as well. So young people learning about calorie density and the different types of foods, and then actually literally tugging on their parents' sleeves to say, you know, we should buy this instead of that, and not like going for those junk foods that we think kids are always trying to convince parents to get. So on our website, we have over 140 resources. As I mentioned before, they're all free. They can be streamed and downloaded. All you need to do to download them is create a free account. Everything from music and music videos and comics. And what's also fun, especially in the education space, you could sort by through the repository by grade level, by content area, so health literacy, physical literacy, mental health. We do a whole series of featured collections, especially when we partner with another organization, and everything is aligned to the National Health Education Learning Standards, Physical Education Learning Standards, and the Healthy Out of School Time Standards that organizations like the Alliance for a Healthier Generation uses for school wellness councils, and also a lot of YMCAs and boys clubs use. You'll also see our resources clustered around many types of content areas. So these are our main areas, healthy eating, physical activity, stroke, mental health, nutrition. And most recently, of course, we had to pivot last year when we were all faced by this incredible pandemic. So one of the first things that we did was we took all of our physical activity resources, and we call them Hype the Breaks. And Hype sounds fun, but it stands for Helping Young People Energize. And Joni actually yesterday participated in one of our Hype previews. We're launching another series of 60 minutes of physical activity videos next Monday with the Cooper Institute. And Joni joined us for a little preview on YouTube. So thanks, Joni. But we pivoted and rebranded this to Hype at Home so that this could be used for physical education, for physical activity, and even for families to take a mental health break just by dancing in their living room. And our Hype resources range from 2-minute dance breaks, 6 minutes, 10 minutes, and now we're coming out with a series that are 15 minutes, and we have over 30 of them. We also felt like it was incredibly important to really focus on the behaviors that were relatively easy, relatively cost-free, that can have a huge impact on our communities. And particularly at the start of the pandemic, we were seeing the devastating impact on communities of color. Now we've, passed the 500,000 mark. We know that this impacts longevity in such a devastating way. And at the beginning, we just felt like it was so important to really focus on these areas. So we created an educational PSA based in our model called 20 Seconds or More. We followed that up right away with one in Spanish called 20 Segundos or Más. And then we created a beautiful R&B, almost love song with Raheem Devon, who's the R&B love king, and DMC from Run DMC, and that is Behind the Mask. And what was ironic, that one we launched in August on the birthday of hip hop, August 11th, the 49th birthday of hip hop. And we thought we were too late. We thought, oh, by now everyone's going to know that they have to wear a mask. People are going to say, why is Hip Hop Public Health putting this out there? But clearly we were not, and these are still very important messages. And I would say, as we, get towards the segue of when we talk about how we met HeartSmiles, it was around 20 seconds or more that we met. And then I was introduced to Joni by Nanette Smith from Bloomberg Philanthropies, and Nanette and I had worked together when I was at the New York City Department of Education when Mayor Bloomberg was mayor. And we connected, and right away Joni said, how about you guys come and do a session with us? And so we brought Dougie Fresh and Artie Green, one of our producers, and Dr. Williams. And I have to say that was one of the most impactful sessions that we did for us and for our team, to be able to talk directly with young people who care so deeply about their communities and their families and the health and well-being. When we produced 20 Seconds or More, one of the heartbeats is actually in the video as well. And so we've been, talking about how we can collaborate and what we can do together. And now we actually have some real next steps planned. So I'm going to tell you a little bit about Community Immunity, which is our latest resource, and we feel it's really the most important work we will probably have done so far. And this is an anthology of 5 videos about vaccine literacy, and we were very intentional about not calling it vaccine hesitancy. We know that there's a lot of uncomfortable and unlikable feelings when that comes up, because there's a lot of reasons why people, and particularly people of color, will be hesitant. And so we felt it was important to really focus it around a journey of vaccine literacy. And so, the goal really is to ultimately change attitudes towards wanting to get vaccinated, but we also know that behavior change doesn't happen overnight. So it's about having these conversations. We intentionally made these videos short. There's lots of concepts to share. So we broke them down to 60 seconds. We also like that because it's easily shareable on social channels, but also if a radio station, TV station has PSA spots, to use, that fits nicely into a PSA slot. DMC is the featured artist on this, along with Artie Green, who's a beautiful gospel singer. I'm sorry, that's Jerry Gunn. Artie Green is our producer, the person who wrote 20 Seconds or More as well. He wrote this and produced this. And our very own Dr. Williams, his alter ego, the hip hop doc, appears in the videos along with Dr. Mo Flo, who is Monique Hedman. She actually did her MPH at Columbia with Dr. Williams, and now is a first-year resident at UCLA. And so, medical oversight, of course, was provided for this to make sure that everything is factual and accurate. And the themes are what you see in front of you on the screen. And so each video tackles a little bit of one piece of this journey of vaccine literacy. And so if you're up to it, I'd love to show you the first three. We can't show you the fourth one or the fifth one because we don't have them yet. We're literally building the plane as we're flying it. We just launched this February 11th or so, and every Thursday we are sharing another video. So you'll actually get a sneak peek of video 3 that's coming out tomorrow. But I'll show you the first one, and then after the second one, I think we might want to start a little bit of the conversation, because before we got on here, Young Elder and I were chatting about some of the concepts that are in here, and I'd love to kind of get into that, and then we can open it up to questions. So here we go, and just give me a thumbs up if you can hear this.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity, I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. Alright, there is none higher. DMC, I will inspire. Time for us to trust and not debate. The vaccine, believe it's safe to take. 9 out of 10 people won't get sick. That's 90% effective and legit. This COVID thing is real and it will find you. It's killing our people, let me remind you. Back in the days, there was polio, smallpox, back in the days. Measles and mumps, man, back in the days. But because of the vaccines, none of those save. Vaccines, they work to trigger immunity. 2 shots, we got antibody security. We gotta act now, no need to wait. Get your vaccine before it's too late, for real.
All right, so that's video 1. And let me show you video 2, and then we'll take a pause.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine.
That's video 1 again. Let's go to the next one. There we go.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We can get back to normal, let me inform you, let's all get the vaccine. It's about community immunity, I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. Alright. Trust me, believe me, we're not gonna have another Tuskegee. This ain't eugenics, no way. Nobody getting away with hiding information today. Got the FDA, CDC, black doctors and experts for you and me. There's a whole lot of data for the world is free. Do me a favor, check it out and you'll see. I gotta give a shout out to all of those involved that's helping us get this problem solved. People wanna know, is the vaccine safe? It doesn't have anything to do with race. 9 out of 10 people won't get sick. That's 90% effective and legit. We gotta act now, please don't wait. Get the vaccine before it's too late, for real. I got the vaccine.
Before we get to the next one. So before we go on, what you'll notice is that a couple of things. One, the hook, the beginning part repeats. And we do that so that there's that element of social norming. So that gets in your head over and over. I got the vaccine, you got the vaccine, we got the vaccine. So you'll see that in every song. Then we also used animation for a couple of reasons. One, I mean, clearly now is not the best time to do live action video during COVID, but primarily we now can change the backgrounds and the backdrops and really micro tailor this work. And that's what we're going to be doing with HeartSmiles, we're going to be tailoring these 5 videos specifically to Baltimore. So to have like an even more, you know, micro-tailored, culturally relevant, like what should the background look like? What should, so that when someone sees this, they say, oh, that doesn't look like me. That looks like New York City. That looks like this. So it really feels like this is for Baltimore, from Baltimore. So we're going to start with Baltimore as sort of our test pilot. And then we hope that other cities and other organizations and even businesses may want to use this to adopt and adapt it to their communities. The other thing that you may notice in here is that whenever people are within the, you know, we try to show physical distancing. When you don't see mask wearing, that's when we're talking about sort of the getting back to normal. So it's like those images of the types of things that you might want to be doing at the diner, hanging out outside, that kind of a thing that we can't do now. So we were really careful to pay attention to that. And this one, you know, I would say after we launched the first one, a lot of people said, wait a second, you're just going to tell us trust doctors and you're not going to mention Tuskegee, you're not going to mention. So young elder, do you want to mention what you were saying before we got on today?
Yes, so this is actually my first time seeing the second video. And like I said before, there's been a lot of distrust when it comes to the medical field and African-American community, because like they said, you know, there's been lies, and the Tuskegee experiment, you know, Black people were injected with syphilis and they weren't even told about it. So that's obvious that it could create a level of distrust. So that's why this is so important, and that they added that to the video. A lot of people don't learn about the Tuskegee experiment. Like, I didn't learn about it until somebody outside of school told me about it. So I think it's very like crucial that we put it in the video, because now people can see it and they'll say, oh, that really is a issue.
Thank you so much for sharing that. You know, I mean, that just hearing that feels really validating from the approach. I'd like to show you the last video, which is sort of the last part of our presentation, and we can get more into the dialogue. The next video is a little bit more about the myths and misperceptions. And you'll see the hip hop doc make his debut in community immunity on this. So let me make sure that this is the right one. I think it is. Let's move this back. Let me just make sure. Nope. Here we go.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We could get back to normal, let me inform you, let's all get the vaccine. It's about community immunity, I'm talking unity for you and me. If Doc says it's good, then trust me, it's good. Now let's all get the vaccine. Hey, Doc, what's going on? I got a question.
About the vaccine lies and misperceptions.
Now, if it's true or if it's false, I mean, a lot of people lost. They want to know, do you got any suggestions?
I got a few. Now I'ma do my part to help. The vaccine is safe, I got the shot myself. The misinformation a lot of people facing, the hip-hop doc came to erase it.
They say the shot will give you COVID.
Nah, it won't give you COVID.
Now wait a sec, you saying it protects you from COVID?
Not only will the vaccine protect, but those with underlying conditions need it more than the rest.
Will it affect our DNA?
That's false, don't believe it. The vaccine will help us, we need it.
It's not just the moment of truth, but the moment for truth.
The vaccine is safe,
believe it.
So you are the very first people, oops, let me move that to see video number 3, which is coming out tomorrow. What you see here is just the landing page of our website. So we have everything about community immunity on one page. We have, you know, the art, the music, the science, links to all the videos on YouTube, links to videos that are native files. If you want to share, you just click spread the word and it brings you to a social media toolkit. Also links to the creative assets. So the actual video files, if you wanted to use them within, you know, your presentations, if you work with schools or communities or even your family. I would say that we've received a lot of positive feedback from communities and from partners, and we've also been trolled quite a bit from the anti-vax community. And it's been intense, We've never really had that kind of pushback with any of our other resources. And I think it's important, we've learned when we post on social media, we don't hashtag vaccine, because then that's an automatic, people, flock to us and say lots of negative things. We had to moderate our YouTube, our Instagram. We have a lot of young people that come to those sites. We had to disable comments and filter the comments so that stays a safe space for young people to see it. But we appreciate you sharing it. And for those of you, and I see some things in the chat, who have ideas about sharing, we look at this as a long journey. This is not about just launching a resource each week through March. This is about having community conversations throughout the rest of the year. It's going to be a while before everyone is able to get vaccinated, and we want to make sure people feel comfortable when it is their turn. And last, before I turn it over to conversation, we have an event coming up this Saturday. You're all welcome to join and share. We're doing a live chat with DMC, with Dr. Williams and Dr. Moflo, who you'll see her in video 4, and also Emma from the Office of School Wellness Programs in the Department of Ed. And it's really about engaging families and caregivers around this topic. It's available on Eventbrite to register for free. And we hope that you may want to join us for that live conversation. And so, here we are, we are in it. HeartSmiles, we've been thinking about how we can work closely together. And then, once, we shared this with Joni, and then some of the young people saw it, and kind of, I have to tell the story, and then I'm going to be quiet. So PBS Newshour is doing a behind the scenes making of, community immunity, and hopefully it will be out next week. And so some folks on the screen were interviewed, and what did they do live on camera? What happened? Young Elder, maybe you should tell the story.
So me and Tay Bands, we both had a lost verse for the community immunity. So we put a little bit of Baltimore flavor in it. Not just it looking like Baltimore, but just our verses. And I'm excited for you guys to hear it,
Yeah, so now we have a 6th video to produce. So, it's super exciting. I'm going to just thank all of you for your attention and for your support, by having us chat today. And I will stop my screen so we could, turn it over more to conversations and hear more from, Joni and Charles and Young Elder. And I will also just say that I have our board meeting at 1 o'clock, so I will be hopping off at 1, unfortunately, but so happy to be with all of you here today.
Okay. Thank you so much, Lori, for that wonderful presentation. I'm sure you all have lots of questions for her. So before she leaves, I want to ask Lori a couple of questions, but if you have a question, please put it in the chat so that we can capture it and make best use of her little time with us left. So Lori, can you share a little bit about what are some of the ways this has benefited your organization in terms of reaching the public?
I would say that there are, we've been doing this work throughout a lot of the education space and sort of public health space, but now so many more organizations have heard of us, and it's been a lot of word of mouth. I mean, we do have a little bit of PR support to do, do a press release and put the word out, but a lot of it has been word of mouth and communities sharing and organizations sharing. And, even like everyone on this chat has the opportunity to share with somebody else. So there are new organizations that are now supporting us and that are funding us and helping us to spread and scale this work a little bit more. But we're also, connecting with other creatives. So we are now going to, produce another video that Young Elder mentioned, put us on the spot on news, but also Young Elder in another heartbeat created another incredible track, about the 3 things that you need to keep doing until we get to community immunity, right? About washing hands and wearing masks and social distancing. And now we're connected with incredible creatives that can add voice to the conversation, and that we can work with them to produce that professionally and put that out into the world, So it's been really impactful in terms of the relationships. And, everybody knows somebody else, who can probably help amplify. And I think that that's been the most impactful. And I think just, and meeting other people and other organizations that really care, just care so deeply about communities. And that's what they're in it for. That's what we're in it for. So that's been probably the most impactful thing.
So what's been your individual benefits in being a part of an effort like this?
I've learned a lot about virology and immunology. I've learned more about vaccines than I ever knew before. I personally am so thrilled, to have the ability to meet so many new people. And also I miss, having such a long career in the New York City Department of Education, and now running a nonprofit. I miss interacting directly with young people every day. Yeah. So this particular project, I'm going to be involved in this with you. I'm so excited to be, sort of have a little bit of hands-on connectivity directly with young people, because I really do miss that. But, knowing that what we're doing is really about changing lives and saving lives it just feels like the most important thing that we've done so far. Absolutely.
So you shared with us some of the great benefits that have come out of this work and the collaborations. Have there been any challenges?
Oh, yeah. Well, funding is one. We literally are building the plane as we're flying it. So we're still seeking funding to continue this work. We also want to do an entire series in Spanish as well. So we're trying to work on that. But I think, confronting the reality that there's so much mis and disinformation out there, and that some people are really intentionally putting that out there, and understanding what we can do. We can't control everything, but what we can do to help mitigate that, and really understand how we can best share these messages without them getting drowned out by those that are not interested in having science and facts lead the way. Yeah.
So I want to thank you. Are there any questions from our public health audience and partners?
Well, I am just, I would just say thank you again, Trina and Beth and Dina and everyone behind the scenes, and Joni and Young Elder and Charles. I look forward to all the next things. Oh, also March 2nd, we're doing a session with Rolling Out magazine online, and Joni and Young Elder, I think, and somebody else is also going to be part of that conversation with Dr. Williams, an hour-long feature conversation with them. I get to watch that one. I'm just going to be quiet, believe it or not.
It's good to be the audience sometimes.
So thank you for sharing. Look forward to staying in touch, and just we're so grateful that you shared the work of HipHop Public Health, and know that we are a resource, and love to think of creative ways to partner even beyond vaccines. Moving.
Absolutely. Thank you so much, Lori, for spending time with us, for your transparency, and for doing the good work. We look forward to our continued partnership with you.
Amazing. Thank you.
Thank you. So we're going to continue our conversation with Joni and Young Elder and with Charles. And I want to encourage you to put your questions in the chat, or if you want to be verbal about it, unmute and ask your questions. I'm going to start with some questions to our panelists. So Joni, can you talk a little bit about the partnership between the organizations and your perspective about how and why it came about?
Yeah, absolutely. So the partnership, if I had to describe it in one word, it would be amazing. So anybody who knows anything about Baltimore, you know that the Baltimore culture is rich and just has a lot of genuine excitement around music, and especially with young people. So for me, when I first heard about Hip Hop Public Health, I'm like, wow, like what a match made in heaven, because we have so many heartbeats who are passionate about music and passionate about art. And it's just a really cool way to get involved intimately with something that is positive in a door that might not have never really been open or available to them to work with icons. Like how many people can say that they work with living legends like Dougie Fresh, Run DMC? So coming in, even from the public health perspective, still allows our young people to network, build up their own social capital, so that way they are able to also use these relationships to push themselves forward with their own personal dreams and aspirations. So it really has been just pure harmony from my perspective.
Mm-hmm. And why was it important for you to be part of this? What was the vision that you had for HeartSmiles in this?
Well, to be honest with you, selfishly, for me personally, it kind of helped me get back in touch with one of my childhood passions, which is music. So music was like the furthest thing from my mind. But now with this partnership and dealing with the heartbeats, they get me all pumped, man. Next thing you know, I'm freestyling. They got me DJing, doing all this crazy stuff. So it really has kind of pulled me back into that from a personal perspective. But then also some of the more serious benefits have been like the feature with PBS Newshour. Like we're doing some cool work, but we were specifically invited to that table because of this partnership. And then really just genuinely infusing a whole heap of hope into young people, into our heartbeats, just because of the magnitude of the opportunity, and really allowing them just to be creative in their own right, using their talents and their gifts in this space, I think is an amazing benefit for us just as a whole.
Okay. So that question was actually posed by Cam, one of the heartbeats, and he wants me to extend that question to Charles and Elder. So Charles, what was your personal passion around being part of this project? Why was it important to you?
So personally, I hear so much negative feedback on the vaccine, and a lot of people listen to music. I know so many people that listen to music all day, every day. Me is one of them people. I am one of those people. And so much negativity, and it can be brought through positivity through music. So it helps a lot with the music and the positive messages, and it gets through to everybody because everybody listens to music. So.
Absolutely, Charles. And Elder, what are your thoughts?
So my thoughts are this project is really important to me because I know, like I said before, it's a lot of distrust when it comes to the medical field and African American community. And I really want to not only inform people that, you know, the vaccine isn't all bad because there's so many rumors, but to be a part of debunking some of those rumors and helping actually educate our community. And like Ms. Joni said, giving our community hope, because I listen to music, everybody listens to music, and music has always been an outlet for me. So being able to connect my passion with educating my community about the vaccine, because everybody wants to go back to normal. Like nobody wants to keep wearing a mask. And the only way we can get there is if we work together, whether it's the vaccine or it's something else. Regardless, it's a group effort. So just being able to be a part of that effort is why it's just so important to me. Plus, I love music, so it's like a 2-for-1 for real.
Yeah. So earlier, Elder, you and Lori both talked about adding a Baltimore flavor. So what does a Baltimore flavor mean to you? Can you tell us what that is?
So Baltimore flavor to me means seeing people who look like me, seeing an environment that looks like me, just being able to relate. Because when we look at the video from New York, yes, it's nice, but I don't live in New York. So I can look at it and I can say, oh, that's cool. But for it to actually apply to me, it makes it easier for me to relate to if I can see people who are from Baltimore, people who look like people are from Baltimore. Like that part with the graffiti, I really like that, because even though graffiti may be an issue, it's also a form of art. And you see graffiti in Baltimore, you see graffiti in places like New York. So it made it more, okay, this video actually is for me. Even though that was the New York video, it still made it seem more like relatable, because I'm like, oh, graffiti, like I ain't never seen nothing like that in a video like this. So I really like that. And the people as well, like the people, you could see in the I think it was the third video, like in the buildings, the people were people who look like us. So if I could have people who look like me and they from Baltimore, it's like a double whammy. Like it's just the best, because when you look at the people, you know, some people old, some people are a little overweight, some people skinny, you know, it's real diverse and you could see yourself in it.
So let me ask both of you, and this question is from Marquand. So you talked about Baltimore and Baltimore's style and flow. What do you think is unique about Baltimore, different from other places, that will best serve this video and how it reaches young Baltimoreans?
So just to be sure, you're saying like, what do we think is unique about Baltimore?
Yeah, different from other places. And in terms of like messaging, how do you think it will relate to young people in Baltimore?
I need to think about it. Can you go?
Okay. All right.
Okay, yeah, I got you. So I'm gonna shoot and tell me if I'm answering your question correctly, Moa. So I think some things that are unique about Baltimore would just be like the infrastructure, like the buildings are different. The way we communicate is unique. You know, we say terms that people don't usually say, like dummy, stew, stuff like that. You know, chicken boxes, like that. Those are things that, like, when you go to Baltimore, like, you know that you're gonna see those things and you know you're gonna experience those things. So that's definitely unique and sets our city apart from, like, because you can go to like in Maryland, you could be in, let's say you in PG County, and then you come to Baltimore, like it's totally different. So those are definitely like unique things, and murals, things like that really like make our city stand out. And I think it would be a good way to connect with the youth, because like I said, like when you see things that relate to your community, you kind of care more, if that makes sense. You know, if I see things that look like my city, I'm gonna care and I'm gonna pay more attention, because I'm like, oh, that's the convention center, or that's downtown. So it makes you more in tune anyway, because first of all, you looking like, make sure they got it right. And then you looking at it like, oh, that's cool that they added that in there. So it's gonna make people more attracted to it.
Absolutely. Wonderful answer. So, Miss Joni, vaccine discussions and vaccine promotion can be challenging because of the history and current practices of racism in medicine. So how do you plan to address that during this campaign using the videos? And also, after hearing from you, I'd like Charles and Elder to talk about their perspective on that question as well.
Yeah, and this one is kind of a crazy question, Ms. Trina, because to be totally honest with you, like, I'm not that far removed from people who like 100% doubt the vaccine. And I've only recently begun to transition after doing my own research and being intimately involved with people who are at like the forefront of it, and knowing people too who've actually got the vaccine, and having trusted doctors, trusted researchers, and trusted people in my corner that I can ask that stupid question that I wouldn't ask out loud and get my answers. So had it not been for me having those people in my corner and being able to have those long discussions and long talks, I would absolutely still be with my brothers and sisters who are like, no, you're not about to Tuskegee me. You're not about to, put nothing in my body. I'd rather just take my chances. But I think that the starting point is first allowing people to just make their own decision. Like not forcing people, not trying to twist anybody's arm, but putting information out in a way that's relatable, that's digestible, and that's not intimidating at all. Like nobody is saying you gotta do this. All we're saying is educate yourself, ask more questions, find out more, and then you make the best decision for you and your family. And that's just really been my approach as I talk to different people who are still kind of on that other side. That's just like, it don't matter what it is, I ain't doing it. But I think absolutely when you look at any great change that has happened, youth have been a part of it. Like a youthless movement is a useless movement. So with having youth kind of at the forefront, educating themselves and talking about it amongst themselves and getting the conversation started, I think we just have a better chance of educating people as a whole and getting people to step outside of their box and at least start to ask questions so that they can make an informed decision.
Thank you, Joni, and thank you for your transparency. So Charles and Elder, when we think about the challenging history, right, that we have had in terms of Black and Brown communities trusting science and medicine to make decisions, what do you think we should do differently here? What do you bring to the table that maybe adults don't really have the perspective to bring?
Well, I think the first step, like I said, is education. Definitely just educating people, and like Ms. Joni said, making the information accessible. Like for example, like right before I got on this call, I was in my African American history class, and she was talking about, Black people actually invented the vaccine. Never heard that before. I never heard anything like that. So just being able to know that, it kind of gave me a little bit more trust in that, because okay, it came from my people. So yes, it had fallen into like the wrong system, but we can get it back, so that kind of helped, just being able to be educated on that. And I think one thing that the youth can offer that adults necessarily can't offer is just the youth perspective, because generations, like it changes each time. So something that I go through and something that my mother goes through, it's not going to be the same thing. And like social media, it's so many rumors on social media. Like every time you look at social media, or COVID this, or the vaccine did this, or the vaccine did that. Well, I'm able to offer my growth mindset that, okay, I know the internet is saying this, but I'm smart enough to look at my facts and see what I can actually pull from the facts. So I just think that youth perspective and showing what it's actually like living in Baltimore and living in an impoverished city, because Baltimore is not the only city that we focus on. It's just the city that we starting with. And like Ms. Lori has said, of course, a young person not going to get a heart attack. But if a young person knows the symptoms of a heart attack, if their parent is working all day, I can help, well, Ma, did you notice this, or did you notice that? Stuff like that, helping like provide support, because I don't have as many responsibilities as my mother would. Like once we get together, you can't stop us. Like you can't. And with the youth, like we are leaders. So if we're going a direction, people going to follow us, because that's just how society works. When you see a whole group of people going this way, you're going to follow. So if the youth can start that, then the adults can follow, if that makes sense.
Totally makes sense. So we have time for one last question. I'm going to pose this question to Charles and Elder, okay? So how has working on this project and other projects that you've been exposed to and had the opportunity to experience leadership in and relative to public health, have those projects really broadened your horizons and you're thinking about maybe a career in public health?
Personally, I want to do like computer engineer type things. but it does help because hearing all the negativity around it, it helps me educate other people. So maybe they want to have something to do with it, or I know somebody that wanted to be a veterinarian. So it does help with educating other people. But personally, I want to be in like computer science and things like that. So
okay.
Definitely. Because the COVID vaccine is not the only issue that we're focusing on. It's not going to be here forever. Eventually, we're going to have another issue that we're going to be focusing on. And trauma is a public health issue. So that's something that I'm really passionate about. So if I can see that we can get all of these people on board with the COVID vaccine and, you know, doing the appropriate things to be healthy, then, okay, it might work with other public health issues like trauma, like abuse, like things like that that are affecting the Black community. So just being able to see that it works and seeing what approaches to take that really could help our people, it definitely like kind of broadens my ideas when it comes to this might actually be the right route to take, because people don't talk about mental health, people don't talk about trauma, people don't talk about these things. And before we was doing this, people was talking about the vaccine, but nobody was talking about getting it, you know. So just being able to implement a problem into a form of art, it'll make people want to gravitate towards, yeah, like Cam said, kind of taking away the stigma from that. So definitely, I can't wait to see what public health issue we're going to conquer after the vaccine.
Thank you all so much. And I want to thank our audience of public health professionals and faculty members and staff members at Johns Hopkins, even community members who have joined us. I want to thank you for spending time with us today on this important topic.